I've heard the rumblings and in, the conversations around me of some people say, oh, there's this drug, this injectable that you can have. Go to your doctor and ask for it, and it'll help you lose weight. I largely just heard it on the sidelines, never really paid attention to this conversation. But over the last while, I've been seeing the conversation extend to social media, particularly when you have pharmacists on the accounts say, I'm getting a lot of people asking for the drug Ozempic. It's a diabetes drug, and it's causing some controversy, as some doctors are also prescribing Ozempic to patients who have no medical emergency, who are not diagnosed with type 2 diabetes, except wanting to lose weight. Meanwhile, those who are struggling with real obesity issues and patients trying to control their diabetes are having to deal with an apparent shortage of the drug. Joining me now is Dr. Joel Daves, who is the head of endocrinology at the University of Cape Town, as well as Dr. Charlene Wolberg, who is the MD specialising in nutritional scientists. From some rumblings, at the BRI conversation, some people talking, you pick up on what people are talking, Charlene, to what I've been seeing over the last while on social media. Pharmacists saying, oh, we're concerned. People are asking for Ozempic. Have you heard of this growing phenomenon of some doctors prescribing a medicine for type 2 diabetes for people wanting to lose weight? Good morning, Charlene.
Yes, I think this is a problem that's not only isolated to South Africa, but it's become quite a worldwide problem. I think what's happened is that because the pharmaceutical company Novo Nordisk has basically launched a few of these molecules called these GLP-1 receptor agonists that all belong to the same class, and are registered for both type 2 diabetes and weight loss, there's been a bit of confusion as to which drug is registered for what, and then the off-label usage of one of the drugs for the other indication. Important to note is that in medical practice, it is not unusual to use medical medicines for off-label use, and it's a common practice in medicine. However, I think this problem with Ozempic has become quite hyped in the media because of so many celebrities using the medications, because of the hype, not only in sort of the local media, but in journals such as The Economist. I think conversations people are having around their dinner tables. And also is that weight loss is a very controversial and interesting topic. So I think all of these have led to kind of this conversation around Ozempic and the use of Ozempic quite prevalently now being used off-label for weight loss.
Joel, from an endocrinology point of view, how does Ozempic work to treat type 2 diabetes, and how is it being used for its off-label use?
So as Charlene mentioned, Ozempic is an example of a drug that belongs to the GLP-1 receptor agonists. They've been shown to do a number of very good things for people with type 2 diabetes. So what a GLP-1 analog can do, it can go to the beta cell of the pancreas and stimulate insulin release and help the diabetic person to control their sugar. It also goes to the brain and reduces appetite. So it helps the person lose weight. And then these were one of the very first drug classes to actually show in people living with diabetes that they could actually prevent heart attacks. So very, very good drug for people with diabetes. Just to add to what Charlene's been saying, unfortunately, alongside the pandemic of diabetes, of which there's over 500 million people in the world, runs this pandemic of obesity. And obesity per se, just by itself, has a very high morbidity and a mortality. And often the two interlink. So some people call type 2 diabetes diabesity. And so you are getting this off-label use of Ozempic because of the weight loss that has been shown in people with diabetes, and also because it seems to be a little bit more accessible than the other molecules that have been approved for weight loss that are quite a lot more expensive.
A message here, Joe. Ozempic is expensive. My husband is diabetic and can't get it anymore. It was prescribed by his endocrinologist a year ago and now he can't get it. It's shocking. He's taking something else in its place. In my notes here, it says that a 1.5 milliliter injection pen costs between 1,200 Rand and 1,500 Rand. An injection pen lasts for between 1 or 8 weeks, according to my notes. When we talk about accessibility to particularly people who are not on generous medical aids or medical savings schemes, is it quite difficult to get one's hands currently on the Ozempic injection pen?
Yes, so from a price point of view, it is very expensive. And actually, many of the medical schemes don't readily fund it. You have to specifically motivate for it. And many of the top plans in the schemes are the ones that actually you will only have limited access to it. But if you compare the Ozempic to the drug that has been approved for weight loss, it's half the price. So generally, the two drugs that have been approved for weight loss in this class are in excess of 3,500 Rand a month.
Wow. And there are people who are approaching their doctors and saying, doctors, Charlene, I've been dealing with the issue, whether it be for, legitimate health concerns or whether it be for vanity concerns. And that's simply the reality of many people. They are getting off-label access by going to the doctor and saying, I am willing to pay this price simply because I'm unhappy with the way I look, Charlene.
Yes, absolutely. I think something needs to be highlighted. And that is that when prescribing Ozempic, it's very important to differentiate between two classes of patients. So the first, as you mentioned, is the patient looking for cosmetic weight loss. And the second is a patient who suffers from obesity as a chronic disease state and is associated with obesity and all its associated diseases. So, for example, high blood pressure, high cholesterol, etc. And what's important to know is that obesity itself is now considered a chronic disease state. And many patients will put forward the argument, and many practitioners in addition, to say, what makes one disease more important than another? So you can just throw out a question to say, do we wait until the patient is diabetic, till we offer them treatment? What do we actually wait and do? Also, what's very important to understand is that Ozempic is only one part of the management of an overweight obese patient. It has to be stressed that it comes with part of lifestyle management. So to go to a general practitioner and just get that script for Ozempic, you're not going to get the maximum benefit of the drug. Even when the drug company actually did the trials on the drugs, it is done with patients being compliant in terms of lifestyle, i.e. following a calorie-controlled diet, following an exercise program, and being monitored. So I think that's also a very important consideration when using Ozempic and who the Ozempic is being prescribed by.
We note and we know that obesity is a serious health condition for many people. But I think we also have to note, and I'd like your opinion on this, the note in the rise of the medical aesthetics industry. There are parts of Cape Town when that particular branch of medicine is thriving, and whether that is a concern to you, where people are taking aesthetics as reasons for seeking some medical help or guidance or prescriptions over the legitimate health concerns. Your thoughts on the medical aesthetics industry?
Sure, Lester, it's a loaded question. Look,
Yeah, quite targeted.
everyone is entitled to access to healthcare that they feel that they need. And as long as they are educated on the risks and benefits of everything that they're going to be taking, and that they are able to fund it, then one can do it. I like very much the way Charlene divided the patients into those, especially for weight loss or obesity, or those that are doing it just for aesthetics, or those that have serious morbidity associated with their weight, and that's a chronic disease that definitely deserves treatment as much as someone living with diabetes. But the whole aesthetic market, where they're using a lot of Botox, fillers, other hormonal therapies to restrict aging, to promote looking better, is a very big debate that perhaps we can have on another talk.
I'd like Charlene to weigh in on that. There's lots of discussion, even research, on how one's outward appearance affects one's internal mindset. How we largely look on the outside affects how we feel on the inside. But talk on the medical aesthetics industry, particularly in Cape Town, if you're willing to weigh in on that, Charlene.
Yes, absolutely, because my clinic actually deals with both kind of patients. So just to mention at the outset is that from a medical point of view, we have clear criteria of which patients qualify for weight loss medications based on their body mass index, which is just an equation looking at weight and height, and together with diseases that are associated with being overweight. So that aside, patients then who come in for cosmetic reasons, again, it's very difficult to answer, because obesity is not only, or overweight for cosmetic reasons is not only a physical condition, but it's an emotional condition. Many of my patients who present to me who have been just mildly overweight for sort of since childhood often come with a lot of emotional baggage associated with being overweight. We know from many studies that overweight patients are discriminated, starting off sort of at school, being bullied, then in relationships, and then in the workplace. So as Joel said, it's very difficult to assess, how much of an impact this weight actually has on the person, and who deserves to be treated and who doesn't. However, I am seeing quite a unnerving phenomena in the community in which I work, which we see Ozempic actually being abused, and some patients becoming so-called addicted to Ozempic, and where weight cannot become low enough. Patients feel that they reach a goal weight, and they see with this medication, too low has no limit now. And so that is becoming problematic. And again, that reinforces the message that it should only be prescribed by a proper medical practitioner, and preferably by somebody that is actually in the field of weight management. Because we know, that being underweight comes with a whole host of medical complications as well as being overweight.
Some concern here from a listener saying that off-label use is common practice is quite concerning. Products are put through many tests to obtain specific registered use, and this should and is against the law to recommend for use that is not recommended as per label. From what I understand, Joe, Ozempic is registered for weight loss. It's just not registered for weight loss in South Africa as yet, Joe.
Yes, to my knowledge, Ozempic is not registered for weight loss. The other drug, so the active ingredient in Ozempic is semaglutide. And semaglutide is also in another drug called Wegovy. Now, Wegovy is registered outside of South Africa, and especially by the FDA for weight loss. So the actual active ingredient, semaglutide, is registered for weight loss.
So the Wegovy variant of Ozempic is registered for weight loss, but they contain the same active ingredient.
Yes, and the Ozempic was the drug, the form of the drug done in all the diabetes trials, and that was where it was shown that people with diabetes, other than having their diabetes improve, they also lost weight. I just at this point just want to re-emphasize something that Charlene said, that Ozempic is not a panacea for obesity. It's additive treatment over and above lifestyle changes once lifestyle changes have failed. And there's also certain risks associated with taking Ozempic. So it's not, or any of the drugs from the GLP-1 receptor agonist class. So none of the drugs are panaceas for diabetes. There are some people who don't lose any weight, and in fact there are some people who gain weight. So it's not a panacea for everyone. And it certainly doesn't replace lifestyle changes.
To temper anyone's curiosity, let's talk about side effects, Charlene, for Ozempic, used primarily as a type 2 diabetes medication. Some people being prescribed it for weight loss. So let's talk about side effects.
There are side effects, and they're actually the same side effects for all the class of the GL1 receptor agonists. The commonest side effects that I see in clinical practice are normally all gut-related. They're normally mild and transient, but vary from patient to patient. And the commonest things I see are nausea or vomiting, and then either constipation or diarrhea. We try and minimize the side effects by starting off at a very low dose and then slowly increasing the dose and monitoring carefully for the side effects.
Really appreciate your time. Thank you so much for this really fascinating conversation. I probably want to tackle the medical aesthetic industry a little bit more, but we'll save that for another time.